You're watching TVC Breakfast. Childhood cancer is the leading cause of death in children under 18 globally. Every day in Nigeria, 46 children between the ages of birth and 19 years are diagnosed with cancer. That is according to the Pediatric Society of Nigeria. Childhood cancer tend to be more aggressive than adult cancers. Reports say that out of every 4 children diagnosed, 1 will not survive past the next 5 years, and 3 will have lifelong complications due to aggressive treatments. And when treatment stops, an entirely different battle begins. Young cancer survivors live the remainder of their lives with the side effects of their initial treatments, some of which include disrupted cognitive development, stunted growth, damaged speech and or hearing, learning disabilities, and physical handicaps due to nerve damage. Though there is no known cause of childhood cancer, as some children are even born with it, early detection remains key. And that is what we'll be talking about now. Joining us now is the medical doctor at the Lagos State University Teaching Hospital Research Associate and the Dorcas Cancer Foundation, Dr. Azeezat Ajose. It's nice to have you join us this morning.
Good morning. Thank
Welcome.
you for having me.
Thank you. And thanks for giving us the gold ribbon. The gold ribbon is for to commemorate this and all of that. We stand with you in all of this together.
All right, so let's begin this way. One of the reasons for this month, the Awareness Month, is to also drive awareness for everyone, not just parents, but everyone, including the government. But thus far, we've been creating awareness over the years, and I'm wondering how far we have come with that awareness and how has that helped with early detection.
Yes, thank you very much for having me. Good morning to all the viewers. So I would say that September is Childhood Cancer Awareness Month, and over the last couple of years, quite a lot of awareness has been made. It's not like it used to be. Far more doctors and primary care workers are now enlightened about it, and as such, we find that we have higher rates of diagnosing this disease than in the past. Previously, it used to be estimated that more than half of childhood cancer cases go undiagnosed in Nigeria and other low-income settings. But with increased awareness, a lot of people now know about it, and we get to diagnose far more cases. Like he said, about 400,000 childhood cancer cases are diagnosed annually worldwide. And in Nigeria and other low-income countries like Nigeria, we account for about 80% of that number.
Wow.
Yeah.
80%?
80% of that number. Because of the fact that aside research is going on to find out properly understand the causes of childhood cancer. However, some have been linked to infectious causes, and in this part of the world, that's still a significant burden of public health problems. So things like HIV, hepatitis B, not a very significant amount, but yes, a part of it. Other genetic abnormalities like Down syndrome can also increase the risk of a child getting cancer. And as such, we have that high number. At the Dorcas Cancer Foundation, where I work, we like to increase awareness about childhood cancer, both for parents, caregivers, the general public, the government, and even for healthcare workers that would diagnose these cases early.
All right, now, just give us, because you have been with the children, you've been in the hospitals, from your observation, how ready or not ready are we when it comes to tackling these issues headlong? Because this has been with us, and statistics show all of these figures that we're seeing here and reading out. Of course, this didn't come overnight.
Yes, so I would say that we're not where we used to be, but we still have a long way to go. So in childhood cancer is highly curable. In high-income settings like the USA, the UK, and other countries, high-income countries, survival rates go as high as 90%. So 9 of every 10 children diagnosed with childhood cancer gets to survive the disease. In fact, they no longer even talk about surviving disease, because for some of these cancers, it's almost guaranteed that the child will survive. What they are worried about is more of long-term side effects and some of the things the child can suffer from later in life. However, here in Nigeria and other countries in sub-Saharan Africa, our survival rate is still about 20% for a lot of this cancer. It's still less than 20%.
What are we not doing right? Why is it
so that is one of the reasons for this awareness session.
Right.
So we need a lot of early detection in order to catch these kids early and institute appropriate treatment on time. A cancer that is caught at stage 1 will be more curable than one that is caught at stage 4. So we need to raise awareness for it. Aside that, for people that do get diagnosed with this cancer, a lot of the time, the financial toxicity from cancer treatment. Now, to treat a child with cancer in Nigeria, a parent has to have about 2 million naira. Because the child is likely going to need, for some, they would need surgery, some will need chemotherapy, some will need radiotherapy. For some, they will require a combination of either 2 or all 3 of them. And as such, it is a very expensive treatment. So we find that a lot of them, even after diagnosis, they want to go back home to regroup and make funds. By the time they're coming back with that child, the cancer has progressed far beyond what they initially came with.
So are we helpless as a people? Because the picture painted here is a very disturbing one, I must say. And these are the realities of our people on a daily basis. So how helpless are we? Should we all, the moment you give birth to a child, should we all go to check regularly, or by the time you notice anything, that is when you should go for a check? At what point should anyone begin to go for a check?
Yes, so unfortunately, I would say that childhood cancers do not have specific symptoms. So there are no specific symptoms like, say, okay, a person has ulcer, you expect this person to come down with stomach pain. There are no specific symptoms for childhood cancer. And a lot of the time, we expect healthcare workers to actually have a high index of suspicion. So we all have our roles to play. As members of the public, as caregivers, as parents, as family members to children, when you notice a child consistently, persistently falling sick, having the same symptoms over and over again, you treat malaria today, the child in the next 1 week is back again with the same sickness. So there are different symptoms depending on the type of cancer. A lot of them, the general non-specific symptoms, they can have fever, the child can start to lose weight recurrently. A lot of younger children complaining of headaches, that's abnormal. Children complaining of bone pain, children looking very pale or bleeding excessively. So a child just eats something and all of a sudden starts to bleed under the skin or bleeding out in different ways. You see that that is an unusual sign for a child. A lot of people go to the hospital. So several people also self-medicate at home and do not even visit the hospital at all. And as such, by the time they're eventually visiting the hospital, this child has gotten to an advanced stage of cancer. Several other people go to hospitals where they just treat malaria, typhoid. As a parent, as a caregiver, that's the advocacy for us to play our own part. When you notice your child having the same symptoms over and over, you're taking this same child to the hospital repeatedly, you need to request to see a pediatrician. So a pediatrician is a medical doctor that after the basic medical training has gone on to further specialize in pediatrics, in the care of children with cancer. Usually, in the care of children rather, some do further specialize to become pediatric oncologists and start taking care of children with cancer specifically. So if you find that your child keeps on having the same symptoms, don't just keep going to the hospital to see a doctor with basic medical training. Request to see a specialist. Let that specialist look that child over and make a proper assessment so that you don't detect things that could have been detected early, much later when it is harder to treat.
How quickly does this spread? Because you said that sometimes when the parents come to the hospital with their children, before they regroup to get some monies, the cancer has spread all over the child. Talk to us from that point of view, how it's easily spread such that parents can quickly address it and nip it in the bud.
Yes, so it depends on the type of cancer. There's no specific timeline. No one can say that if a child has leukemia, so there are different types of cancers. No one can say that if a child has leukemia, within 2 days it will spread, it will get to this stage. The advocacy, the main message is that as soon as a child is diagnosed with cancer, the child should start treatment immediately. Now, a lot of the time, everybody has a part to play. We've been urging the government to introduce health insurance policies for children living with cancer so that it will ease the burden of their parents. We as a foundation, we also fund cancer treatment for children. And we're always in the lookout for partners, for people that want to donate to help these children. At the Dorcas Cancer Foundation, since inception, we funded about 60 children, more than 60 children who have cancer, direct funding of their treatment. Several other foundations do this. So even as members of the public, we can key in. There are several children today on our portfolio, on our team that require treatment but are still struggling to pay for it. So you need to institute management immediately, and doing that requires a collective effort from both the general public, well-wishers, good Nigerians, good Samaritans that want to contribute, you can always reach out to us to do this. You can always go to the hospitals to do this.
All right, we'll come back to you on this because people need to know, especially now that we're talking about children, people need to know a lot of things around this. We'll come back shortly. You're watching TV. You're watching TVC Breakfast, and on this segment, we've been talking about cancer in children, and we're using this month to create awareness. And you can see me with a golden ribbon here because we're commemorating this to create awareness. We all have it in the studio right now, and we have from the Dorcas Cancer Foundation, Dr. Azeezat Ajose. She has been enlightening us in this regard. Now, Dr. Ajose, the point there is we recently, from sometime from last year, we've been having on the news a lot of your colleagues involved in the Japa ministry. Let me put it that way in the lighter note, but the brain drain, where a lot of doctors are leaving and traveling abroad. How is this impacting on the intervention process about what we're talking about?
So medical brain drain is a very significant problem that we have in the healthcare sector, and it is impacting on every single disease that we can't be managing in Nigeria. And I really think that that is a problem that has to be catered from the Nigerian government angle. They need incentives. They need to incentivize young doctors to stay back in the country to specialize in this disease.
But those who have left, how is that vacuum impacting on your intervention for children with cancer?
I'll say that it impacts greatly on it because a lot of the time, children come to the hospitals and they want to see a doctor. Several primary healthcare centers are understaffed and they do not have medical doctors. So a lot of them do have medical doctors, but they do not have enough medical doctors. Because of this understaffing, we find that children are at risk of going to other centers where they do not see a doctor, and it can impact on early detection of these cases because the people they get to see are not medical doctors that are licensed to see them. A lot of the time as well, when you get to public tertiary health facilities, you find that the understaffing of doctors also increases the wait time that patients have. So a patient comes to see the doctor today because there are only very few specialists, very few resident doctors. They give them long appointments. The child has to come back maybe in 3 weeks to see the doctor. Within that time, the cancer continues to progress. So yes, I think it's impacting on cancer care in Nigeria greatly, generally, and even other health conditions. It's impacting on it generally.
Right. Let's look at treatment right now. You know, over the last 30 to 50 years, there's been medical breakthrough in terms of treatment for cancer. But then the impact it's having, when you talk about chemotherapy, the impact it has on the patient has been of concern. Let's understand how far we've come with alternative treatment that wouldn't have adverse effect on the children, because that is also of concern to parents and caregivers who have persons they're caring, who have children who they're caring for with cancer.
All right, thank you for that question. So like I said earlier, a lot of the time, childhood cancer is highly curable, right, and survival rates can go as high as 90%. For now, the standard regimen for treatment of childhood cancer still remains surgery, chemotherapy, and radiotherapy. So this survival rate of 90% have been recorded in people that have used these treatment options. And I understand that a lot of people are worried about the side effect. And a lot of time in medical literature, we tend to balance the risk against the benefits. We tend to balance it properly. Most childhood cancer survivors that have gone on to live long lives tend to have side effects from this treatment. If they had brain cancers and had radiotherapy to their brain, they can have cognitive disabilities. If they had eye cancers, the child can become blind in the end. But we need to balance that against the risk of losing that child. So it's better for us to preserve the life of that child and then
to lose the child. Yes,
than to lose the child, and then try to improve the quality of life as best as we can as the child lives on, than leave standardized treatment options. Because a lot of people, when you Google chemotherapy, so I had a patient, this was an adult that had cancer recently, and because of that got diagnosed with cancer, because of the bad press about chemotherapy, the patient opted to refuse chemotherapy and eventually came back to pass away in the hospital. because she tried all of those alternative therapy. Now, if you Google, you will see don't eat sugar. If you Google, you will see don't eat this, don't eat garlic, starve yourself. A lot of people go fasting for long days because they want to starve the cancer. Now, if you refuse to eat because you have cancer, basically, cancer is like you have cells in the body. Now, cells are supposed to grow, multiply, and then die off in a natural fashion, and new ones should replace them. But in cancer, there is a mutation. So something changes, the DNA gets injured, so to speak, and one particular cell starts to overgrow and outgrow the others, crowding them out. It doesn't allow the normal cells in that organ to do its normal function. So that cell is already injured and programmed to multiply. So if you starve yourself, if a cancer patient starves themselves, what eventually happens is that the cancer cell feeds on the little sustenance that the person is getting, and the person just continues to lose weight because the other cells are not getting nutrients. So a lot of those alternative therapies, so to speak, are not scientifically confirmed to be effective. So we would not advocate for people to go with them. Rather, once your child has symptoms of cancer, and is diagnosed of cancer, listen to your oncologist. Try to see a pediatric oncologist if you can in tertiary centers. There are 2 in Lagos, Lagos University Teaching Hospital, where I work, and the Lagos State University Teaching Hospital, where you can see pediatric oncologists to tell you the best way to manage your child. That responsibility is on us, the healthcare professionals, to tell you what to do. Then you can read up on it and follow the advice.
All right. Thank you very much for that insight, Dr. Azeezat Ajose, Dorcas Cancer Foundation. Thank you very much for coming.
Thank you very much for having me.
Thank you for what you do.
Thank you very much for having me.